My name is Martin Ryman. I'm a professor in the College of Veterinary Medicine and also in the Eller College at the University of Arizona. And I have the pleasure of directing our speaker series on human-animal relationships. And it's a real pleasure today to introduce our colleague, Jennifer Wishnie. Jennifer holds degrees in animal science from McGill University, a DVM in veterinary medicine from the University of Saskatchewan in Canada, and also a master in public health, veterinary public health to be specific, from the University of Minnesota. Jennifer has been an associate professor of practice at the University of Arizona at our College of Veterinary Medicine, where she leads the One Health course and is working on One Health programming for the college, which is, of course, very important to us. Jennifer is a public health veterinarian with a global experience in food production and food safety and veterinary public health, and also the One Health aspect I mentioned. And she has been a faculty member previously at the California Polytech University and was also director for the National Pork Board. So it's a real pleasure to have you here, Jennifer, and the stage is all yours.
Well, thank you very much for having me today. This is, I think, a timely topic for Valentine's Day because we are all very attached to our pets, at least this audience in particular. By way of background, I wanted to tell you that I wanted to present on this topic because zoonotic disease is an important topic in veterinary public health, in veterinary medicine, and human health. And it's also an increasingly important topic in light of the zoonotic disease outbreaks we are seeing across the US and globally. And I'll talk about that at the end of the presentation. The other motivation I had behind doing this presentation was I attended a webinar before Christmas that was given to a group of therapists about animal-assisted activities. And one of the primary questions they had was, well, it was on zoonotic disease. And one of the primary questions they had was, well, what is the risk to our clients? Like, tell me what the risk to my client is. And I realized that I didn't actually have an answer to that question. And the person doing the presentation didn't either, despite having spent many years, both of us, in the zoonotic disease realm. So I wanted to look a little more into that exact question. So how would I quantify that, or how would I present that risk to a client or a patient? And so that is what I'm going to look at today in this presentation. So I will start with a brief overview of US pet demographics and then talk a little bit about some of the benefits and risks of pet ownership. For those of you who are not familiar with zoonotic disease, I'll give a very brief overview of zoonotic disease just so we're all on the same page. And then I'll address my big question here. So what does this all mean to me, my family, and my pets? And then I'd like to talk about what I'm calling the other risk, and I'll let you know a little bit more about what that means as we get there, and then wrap up with the One Health perspective, because that is the area that I work in. And it's also, you can't talk about zoonotic disease really without looking at it from a One Health perspective. For those of you who haven't read this book, Pets, Pets, Pets by Kathy Henderson, it's a great book for kids and adults alike. And I think it would be a great clinic waiting room book to have for your clients. So if you haven't seen it, it's worth the look. In terms of the US pet demographics in 2024, and this was from the AVMA Pet Ownership and Demographics Sourcebook. So this is a survey that they do each year of pet ownership in the US. We are a pet-loving nation. So you can see we have about 90 million pet dogs and about almost 74 million pet cats in the US. Approximately 61% of households in the US own a pet. And of those households that own a pet, about 12% own pets in the other category. And I'll address that category in a minute. And I'll talk a little bit later about how they present some unique zoonotic disease risks. And this is comparable to what we see in the EU, where about 50% of households own a pet. This figure is a look at the distribution of that other category of pets in the US, 2023 in the navy and 2024 in the turquoise, So you can see there are a variety of other pets that are owned by owners or by households in the US. Fish make up about a third of that population, but we also have birds, reptiles, poultry, small mammals. And this category, or these categories of reptile, poultry, and small mammals present these unique zoonotic disease risks that I was talking about. It also includes horses, livestock, ferrets, and others. In terms of what our pets mean to us, you can see that pet owners view both their dogs and cats as part of the family, probably not surprising to any of us. And we're probably on that extreme end in the vet world of how we own our pets. This is a picture of me at my previous wedding, and my dog was my flower girl, so definitely a part of the family. And this slide is courtesy of Carrie Rodriguez, who is also at the college and does some excellent work in this area. But there are many benefits of pet ownership. Pets provide us with companionship and social support. And this in turn contributes to well-being, especially among those socially isolated. And we definitely saw this during COVID. Being active with our pets improves physical health, and that in turn provides benefits to improved cardiovascular health. And growing up with a pet has significant benefits for children, including emotional, behavioral, cognitive, educational, and social. And this is my youngest, who is very attached to our dog, of course, until food's involved, and then all bets are off because he's a lab, and the relationship is up in the air at that point. But definitely has had some significant benefits to both my children's development. However, this is a two-way street, and there are also potential risks to pet ownership. Some reported risks include a higher incidence of heart attacks or increased blood pressure. Now, this, if you might remember from the previous slide, we said some of the benefits of pet ownership were increased cardiovascular health. So it could be that these are contradictory findings, or that both are actually true. There are potentially some mental health impacts of owning pets, particularly owning pets that have fractious behavior or reactive behaviors or health conditions. There are risks of dog and cat bites or scratches, and these can both present a physical risk, but also the potential transmission of diseases from animals to humans. The potential for fall injuries. And then, of course, today's presentation is the potential risk of disease transmission from animals to humans. And this is what we refer to as zoonoses. On the flip side, pet ownership can also present some risk to animal health. Feeding practices can have a negative impact on companion animals. We have seen increases in the rates of obesity in cats and dogs over several decades, and these can have both health and welfare implications. The feeding of raw food diets amongst a certain population of owners can result in the transmission of pathogens from the raw food to the pet, and then also from the pet to the owner or the household. Pets can have the human-animal bond. Pets can develop abnormal behaviors, including excessive aggression, fear, and even abnormal repetitive behaviors. And we can also have, which I think is an important note to point out in terms of the responsibility of pet ownership, is that we can also have a reverse disease transmission, so from animals to humans, and we refer to this as reverse zoonoses. For those of you who are not familiar with zoonosis, I like to always refer back to the German physician and pathologist Rudolf Virchow, who coined the term zoonosis and is quoted as saying, "Between animal and human medicine, there are no dividing lines, nor should there be." And this picture is sort of a classic from when I worked in the swine world, used in many presentations to demonstrate our close, intimate relationship with animals in our lives, and also the potential risks of that can present in terms of disease transmission. The definition of a zoonosis, or plural zoonoses, is any disease or infection that is naturally transmissible from vertebrate animals to humans. And like I said, this can also go the reverse way from animals to humans, and referred to as reverse zoonosis. Another term that you might see is zoonotic disease spillover. And that is referencing when a disease circulates in an animal population, normally circulates in that population, and then moves over to infect a population in which it does not normally circulate, like humans, for example. So because we are an interactive college, I am going to have you do an interactive activity. So you can either scan the QR code or text to me. Can you all see the QR code or the text there? So we're going to do it the old-fashioned way by hand because there's not very many of you. So how many of you, or the question for you is, what proportion of known infectious diseases in people can be spread from animals? So number one is 2 out of 10. If you think that, don't be shy. It's okay if you're wrong. 4 out of 10, 6 out of 10. I see a hand from Evan. 8 out of 10. Oh, I see Dr. Funk. All right, thank you. Okay, one more question. What percentage of new or emerging infectious diseases in people come from animals? So we'll do this again. 25%. So emerging, I'll just qualify that. Emerging means that it existed at a low level in a species and now has increased in incidence. So would that be 25%, 40%, 75%, or 90%? Okay, thank you for your participation. All right. So in terms of zoonotic disease, we say 6 out of every 10, or 60% of known infectious diseases in people can be spread from animals. And 75% or 3/4 of new or emerging infectious diseases in people come from animals. And this is a point I'm going to get back to at the end of our presentation, because I think it's an important point with respect to zoonotic diseases. By way of just a little more background, for those who are not familiar with zoonotic diseases, there's a variety of routes of transmission. So direct contact, like handling an animal, say a reptile, for instance, and these are just examples. A fomite, which is an inanimate object, so something like a dog brush, could be a fomite that transmits a pathogen from an animal to a human. Oral, which could be licking, mucous membrane, or a wound, or a bite. Aerosol, which is air transmission, and vector-borne, which we also consider zoonotic diseases, is the transmission via vectors like mosquitoes most commonly, or mechanical vectors like flies. And so that would be moving the disease from the animal to the human. So what does this mean? Again, we've talked about zoonotic disease. We know zoonotic disease is present, but what does it mean for me, my family, and my pets? So in the big picture, there are a lot of zoonotic diseases, and this is CDC's list of A to Z list of zoonotic diseases, and these can be bacteria, they can be fungi, viruses, parasites that have the potential to infect humans. This is a list of companion animal zoonotic diseases from the Center for Food Security and Public Health, who does some excellent, or provides some excellent resources on zoonotic disease if anyone is looking for specific resources. And you can see there's a variety of zoonotic diseases that companion animals can carry. And again, in the big picture, each year we see these multi-state outbreaks of zoonotic diseases associated with pets. And this is a figure of multi-state outbreaks, typically Salmonella, sometimes Campylobacter or others, of animal and animal products that are reported by the CDC. You can see in yellow, we have amphibians, in gray, we have poultry, backyard poultry, and in blue, small mammals, which are like hedgehogs, gerbils, etc. And that all of these have been repeated sources of zoonotic disease outbreaks. But again, that's the big picture. So what does that mean to the individual or to the family with a pet? And patient surveys and epidemiological studies on the topic suggest that the occurrence of pet-associated disease is low overall, but underestimated. So there are not a lot of studies that look at causation of zoonotic disease. There are case reports, there's some epidemiological studies, and they have determined that there is an association, but not a lot of studies, or hardly any actually, that have looked at causation. Likewise, in terms of the data, a lot of these diseases are not reportable, so the data is not collected. The patient in some cases did not visit a physician, so it was not diagnosed. And in other cases, the physician may have missed, so been unaware of potential diagnosis, or misdiagnosed, meaning that they diagnosed it as something else. And there's not a huge focus. There is some focus, but in my discussions with the medical field, not a huge focus on zoonotic disease education in the medical curriculum. In addition to a lack of data, this is a hard question to answer. What is the zoonotic risk to an individual family from their pets? Because there are a lot of variables at play here. And these include pet husbandry, the pet themselves, the geography, the activities people are engaged in with their pets, and the susceptibility of the individual. And I'm going to walk you through each of these to better understand the variables that affect an individual family's risk and how this impacts the answer to this question. So I'm not sure if this is going to work either, although it generally works with my classes, so I don't know why today, but let's try this. Can you click on, is there a QR code or anything there? All right, well, I was going to do this as anonymous, so unless you want to, let's do it. We're all friendly in the vet world here, so let's have no judgment here. So how do you and your pets interact? And I will participate, although I'll be slightly embarrassed in this. So how many of you have pets that potentially sit on the counter, whether you know it or not? Okay, what about feeding your pets? What about sleeping with your pets? What about letting your pets lick you, cat or dog? What about, oh, that was your cat, that was your dog. Okay, so, all right. So we know that we have close interactions with our pets. And when we look at the literature, and this is a study out of Ontario, this group with Jason Stahl and Andrew Peregrine and Scott Weiss do a lot of work in zoonotic disease. And this is quite a large population they were able to gather for this particular survey. And they reported that 75% of households having contact with a pet and have close, intimate interaction. So they sleep with their pet or their pet licks their face. In addition, they determined that about 2/3 of dogs and over half of cats were fed in the kitchen. So a common space where people prepare food and there's the potential for transmission to food and then to humans. And over half of the households with children play in an area where the dog goes to the bathroom. So the potential for pathogens in the feces, and we know that fecal oral transmission is a primary route of zoonotic disease transmission. And children, I'll talk about this a little bit later, also represent a unique group with respect to susceptibility to zoonotic diseases. In the US, and this slide was shared by the American Pet Products Association kindly. We can see that the same sort of results about, excuse me, almost half of the respondents in their pet owners survey, their pets sleep in their bed. And with cats, over 50% of the respondents, the pet sleeps in the owner's bed or on a common surface, shared surface like a couch or a chair. This is similar in other parts of the world. So this is a Belgian study, and they actually divided the categories into highly intense. So you can see dog licks the owner's face, dog licks the owner's hand, dog eats out of the owner's hand, and then some what they call intense interactions. And they found that interactions were widespread. So there's a lot of different interactions. And 85% of the dogs licked their owner's hand, and over 50% of the owners reported being licked in the face. Again, in Portugal, this study looked at pets licking and eating from the owner's plate. So you can see, a fair amount, sometimes frequently daily, sharing bed with the pet, or the owner kissing the pet, or the pet licking their owner's face. So again, pretty ubiquitous that we have these close interactions with our pets. But again, so we know we have these close interactions. We know zoonotic diseases exist. How does this translate into risk of zoonotic disease transmission? And again, we don't have a lot of studies looking at or quantifying the actual risk. Now, this study took things a little bit further. They looked at the interactions that owners had with their pets. And then they did a little bit of testing on the pets. So they tested for Enterobacteriaceae on the fur foot pads and found that about 86% of dogs and a smaller number of cats were positive. They found some parasites, a lesser amount, which could be attributed to flea and tick control. And then they found high levels of aerobic colonies, up to 216 colony forming units per centimeter squared. And to put this in context, if you're not familiar with that, the aerobic colony count provides a measure of the microbial load. And there are standards in hospitals and kitchens, so places where they have high sanitation levels, based on the fact that the elevated mean can lead to higher chances for the presence of pathogenic bacteria. So it's sort of a proxy for the potential for pathogenic bacteria. And on surfaces where food is prepared or in hospitals where we have this frequent contact, like door handles, light switches, bed linens, the aerobic colony count should not exceed 5 CFUs per centimeter squared. So you can see here that this value is significantly higher. And the authors conclude that this really just exemplifies the importance of proper hygiene when in direct contact with pets, because they can carry or have the potential for zoonotic disease transmission. And then finally, there are a lot of case reports in the study, in the literature. I shouldn't say that. There are some case reports in the literature. They make up the majority of reports regarding zoonotic diseases. But the caveat to a lot of this is, again, they are an association. So this is a classic literature review study by Chomel and Son, who did a lot of work in zoonoses a ways back. And they looked through the literature looking for zoonoses acquired from close contact with a pet, and they documented different zoonoses and the type of pet contact that resulted in zoonotic disease in the human. Again, a lot of these were in association. So, for example, a child was diagnosed with plague and slept in a bed with a cat that may or may not have had plague. So what we can see from that is that we have a very close association with pets. We have the presence of zoonotic disease and the potential for pathogen transfer, although still, it's really hard to quantify what the actual risk is here. Other factors that affect the risk of transmission of zoonotic diseases are the pet species and the age. So, for example, we know that dogs have been identified as carriers of Salmonella, Giardia, and Campylobacter. And Campylobacter species that dogs carry can include Campylobacter jejuni, which can be pathogenic to humans. Puppies in particular, on account of their underdeveloped immune systems, have a greater risk of contracting Campylobacter. And this is a report out of the CDC, where they have documented several cases of Campylobacter infection in humans, and 2 outbreaks in the last several years related to contact with pet store puppies that had Campylobacter. What this particular report also raises, and the reason I wanted to show it, was that these isolates were resistant to 7 antibiotic classes, so including all recommended agents. And the importance here to me is that we have this potential for transmission with particularly some species like puppies related to their age, but we also have this potential for transmission of antibiotic resistant bacteria and genetic mobile elements that can then be transmitted into the human population and contribute to antimicrobial resistance. So we often more recently, we've been talking about the risk of zoonotic disease, including antimicrobial resistant pathogens as its own category. The species of pets also presents another variable in the risk of zoonotic disease transmission. So non-traditional pets in particular present a unique disease risk. And so non-traditional pets can be asymptomatic carriers of pathogens. So for example, poultry and Salmonella and Campylobacter, reptiles and Salmonella, and hedgehogs and Salmonella. Again, this is my youngest demonstrating some good risk, zoonotic disease transmission risk behaviors. holding her favorite Elsa pet. But the increased risk here is that individuals or owners are not, in many cases, aware that these pets carry asymptomatically zoonotic diseases. And because they're not demonstrating any clinical symptoms, they're not taking extra precautions when handling these non-traditional pets. Transmission can also be direct and indirect for these pets. So, for example, reptiles have salmonella on the surface of their bodies, and when holding the pet, that can result in direct transmission, but they can also transmit the salmonella to their surroundings. So their tanks, so washing the tanks can represent a risk of indirect transmission, or allowing the pet, the reptile, to roam the house, and then we have transmission to household contact surfaces, which then others in the household, including young children, are in contact with. And this has been a source, non-traditional pets, of several outbreaks related to salmonella. Something I always like to mention with non-traditional pets is that they are also, some of them, uniquely susceptible to reverse zoonoses. So influenza, in human influenza, ferrets and pigs, so pet pigs, are uniquely susceptible to the potential for transmission of human influenza. The CDC presented a summary of identified outbreaks and case reports reported with non-traditional pets in the US from 96 through 2007. And they found that non-traditional pet zoonoses from non-traditional pets are largely attributed to 4 major pathogens. They also reported about 10,000 human illnesses attributed to these pathogens, with 15% occurring in children younger than 5 years. And again, we'll talk about why children represent this particularly unique group for zoonotic disease risk. And then there were almost 20% hospitalizations associated with these. So they definitely represent a variable in the transmission of zoonotic disease risk, both the species and the age of the animal. I won't go into a lot of detail here, but I think it's important to note that geography and activities can also be a variable in the risk of zoonotic disease transmission. In Arizona, we have Rocky Mountain spotted fever associated with dogs and the brown dog tick. This is unique to the Southwest states and Mexico. So we see Rocky Mountain spotted fever across the US, but associated with other ticks. And so the fact that it's associated with brown dog ticks and dogs in Arizona, and particularly with dogs that are free roaming, represents an increased risk in Arizona, particularly on the tribal nations. Rabies, likewise, has a geographical distribution of zoonotic disease risk. This is a map of the different rabies variants and reservoir species. And so what this means is that, for example, on the West Coast, our primary reservoir species are bats. On the East Coast, we see a lot of raccoons and skunks. And what can happen here is that companion animals are in greater contact with raccoons and skunks and those type of reservoirs. And so there's a higher risk of infection with companion animals, and then potential risk of also humans being infected by companion animals. So we see a lot of our cat cases related to human infection with rabies over on the East Coast. Canine leptospirosis likewise follows a lot of the precipitation patterns in the US. Washington State, where I live, reports their zoonotic diseases and keeps track of this. And we see canine leptospirosis and potential human cases or human cases that are associated with it following a lot of the precipitation patterns. And then finally, the category that I think is really important to focus on is the susceptibility of the individual, so the owners and the owners' families. People at increased risk for zoonotic disease include these categories that we refer to as YAPI, so the young, less than 5 years, older, greater than 65 years, pregnant, and immunocompromised. And they are at increased risk of infection, more severe disease, longer duration of symptoms, and more severe complications. And most of this is related to the fact that they are in an immunocompromised state. So older, pregnant, and of course, immunocompromised. and young children as well, because their immune systems are not fully developed. Young children less than 5 represent an increased risk because they also have these close interactions with pets. They're at the same level of them. They can, they're often licked by animals, whereas an adult would not necessarily be right in the animal's face as often as the children are. And they also have this hand-to-mouth transmission. And I had looked at a paper in preparing this where it said that the hand-to-mouth transmission for, children under 3 was 28 incidences per hour, which is quite a bit. They're moving their hands between their surfaces and their household contacts and their pets a lot. So they're at this increased risk for zoonotic disease, both due to their behaviors, but also their immune status. So that brings us to the other risk. So what I've talked about to date, or right now, is that we have zoonotic disease present. We have zoonotic disease in our companion animals. We have these high intense interactions with our pets in many of the population, but it's really, really difficult to quantify this, right? And for all the variables that I spoke about. And I think it's important to recognize that it is difficult to quantify, but there are a number of variables involved, and we should be considering those when we are dealing with patients and clients. And I'll talk about that at the end. But something else that I think, for lack of a better term, companion animals and zoonotic disease represent are this other risk that is becoming more and more prevalent. And what I consider this other risk to be is zoonotic disease spillover of new and emerging diseases. So diseases that we have not seen typically in companion animals that have the potential to transmit to humans. And in particular, based on our current events, we are experiencing an outbreak of H5N1 high pathogenicity avian influenza in the US since early 2024. We've had outbreaks before. This is a unique outbreak because it's infected a large number of mammals in a way that we haven't seen HPAI infecting high pathogenicity avian influenza, or HPAI, infecting other mammals before. And that's included dairy cattle and domestic cats. And infection in domestic cats in the US has been associated with consuming raw and unpasteurized milk from infected dairy cattle, being fed raw food diets containing infected meat, and consuming rodents or birds when they're out in outdoors that are infected with high pathogenicity avian influenza. And you can see here, this is a recent map. These are updated almost daily through the USDA of infections of other mammals with high pathogenicity avian influenza since the start of the outbreak. And you can see here in the black dots, or the black squares, these are our domestic cat infections. And the concern here is that cats can be a bridge to humans from sources like wildlife, poultry, and dairy cows by bringing the virus into the household. So a lot more people have close contact with indoor-outdoor cats than they do with other major sources of H5N1 flu. So like wild animals, dairy cattle, that would be a particular population that is in contact, but a lot more people have contact with domestic cats. So if the virus was able to move from a cat to a human and then adapts to efficient human-to-human transmission, we could be looking at a potential pandemic. So I want to be clear, this is not to be fear-mongering at all, because to date, we have had no confirmed human infections of H5N1 transmission from companion animals to humans in the US. We have had a transmission from a cat to a human of a different strain of HPAI to a veterinarian from a shelter cats in 2016 that were infected with HPAI. But the CDC considers the risk of cat to human transmission to be extremely low, but it may increase with prolonged unprotected exposure to infected animals. So the point here is that I think, particularly in the zoonotic disease world, it is important to consider this other risk, as we're starting to see in this particular outbreak, transmission to mammals that we haven't seen before. So our domestic companion animals may represent a bridge of new and emerging zoonotic diseases to other to humans. And again, the point here is that we need to be vigilant as practitioners, both on the human and animal side, to be thinking about these things when we are practicing. And to this end, the AVMA has released guidance on how infection can be prevented in cats. This is the first time we've seen this sort of guidance out of the AVMA. And it includes thoroughly cooking meat, so not feeding raw pet food diets. Essentially, they said it in slightly different language, not as direct, and refraining from any dairy products or colostrum that are not pasteurized, and keeping cats indoors, which is a new recommendation that we have not seen before regarding avian influenza and cats. Okay, and then finally, I just want to wrap up with a One Health perspective. So in conclusion, I can't definitively answer the question, what is the zoonotic risk to an individual family from their pets? And I'm glad that I had a chance to go through preparing this presentation, because it gives me, and I think, and I can communicate this to my students and others as well, that there isn't a definitive answer, but there are a lot of variables. We know zoonotic disease exists in our companion animals, and there's the potential for transmission, and these variables can influence that. So we need to take measures in terms of educating our students, our clients, and our patients about the zoonotic disease transmission, and as practitioners, remain vigilant about observing these potential transmissions. So really, what I wanted to focus on is that this involves a One Health perspective. We have to be considering these human-animal environment interactions. So we cannot be looking at these in silos where we're just treating the human or we're just treating the animal. We need to be thinking about what are all these interactions that are happening in the household, whether the pet goes outside, whether the pet goes inside, what are the current events with new and emerging zoonotic diseases. And this picture here is from one of my TBL groups in the class of 2027. They all designed their own One Health logos for their TBL group. And I think it just really nicely exemplifies that human-animal environment interaction, particularly with respect to our pets and our families. And also this involves an interdisciplinary I wrote interdisciplinary disciplinary approach, but requires an interdisciplinary approach. So we need to bring together human health, animal health, environmental health, wildlife health, to be able to address effectively zoonotic disease or mitigate zoonotic disease transmission. And in particular, I would like to end with a call to veterinarian and physician collaboration. In assessing the risk, so determining what that risk might be, asking your clients about what their family structure is, or asking your patients what their family structure is, to identify those immunocompromised patients or those variables. If the patient's family, if we're talking on the medical side, has pets, or if we're talking on the human side, if there's immunocompromised people in the house, so we can provide appropriate patient education about the potential risks of zoonotic diseases, and have veterinarians, physicians really collaborating in what that education is, and sharing that back and forth. And so I would like to end, because I have the opportunity of a captive audience, with my class's One Health logos of 2027. A lot of these, the students were asked to bring their perspectives on One Health, and a lot of them brought the perspective of the human-animal bond and the importance of animals in their life, and how that is an important piece of One Health.